It's goopy, itchy, and highly contagious. And if you're a parent, you'll experience this more than likely with your child at least once. We are talking about conjunctivitis, or pink eye. I know. It's something parents start seeing around this time of year, so we've paged Dr. Paul to help us out. Good morning to you, Dr. Paul. Good morning. We need to talk about it, the dreaded pink eye. You hear that, and automatically parents go, okay, no, wait. How do I get my kid away from this dreaded pink eye, conjunctivitis? How do we prevent that? So let's talk about it. Okay, so first off, what is conjunctivitis?
Well, basically, it's the covering of the eye is transparent. So the white of the eye becomes red.
Yes.
So it gets infected. So it's the conjunctivitis.
Okay.
So it's infected or irritated, and that's really what we see. And it's caused by several causes.
Okay.
The most common is infection, a virus or a bacteria.
Okay.
In that situation, you'll have some symptoms, that are a bit different. Allergic is another one.
Oh,
And you can tell the difference with allergic. Okay, a lot of hay fever, for example.
Yeah.
But in that situation, the trick is you get it in both eyes, and they're runny eyes, and no pus.
Right.
It's associated with symptoms of runny nose and hay fever, those type of things, and it happens every year. So that's another difference. And then chemical is one that's sometimes kids can get into their mother's perfume, for example, and irritate their eye.
Yes.
Or at work, somebody can get like a toxic chemical by accident, a chemical spill. And those can be emergencies. Those are quite dangerous. Fortunately, those are rare. But probably the most common ones are the infectious virus or bacteria. So, it's, fortunately, most of these things go away.
They do go away.
Yeah.
Okay, so I'm thinking about parents who are sending their kids to, let's say, daycare or, the after-school program.
Sure.
One child has a little bit of a, irritated eye, and then it turns out the next day or, oh, that child has pink eye.
Yeah.
What is the rest of the family, the rest of the daycare goers, do they have to worry about, because it's so contagious?
Yeah, well, again, it could be contagious.
Okay.
Not as much as people think. However, avoid sharing towels, sharing, those type of things.
Okay.
And that's really the most important thing. And then really treating it,
Okay.
And so the treatment really depends on the cause, but in most situations we have drops, eye drops, antibiotic drops.
Okay.
But importantly, you can put warm compresses. That's important.
Yeah.
That soothes the eye. For allergic, there are some antihistamine eye drops, but it's cool compresses. That's the difference. So if there's an infection, which is a bit of pus, you can have antibiotic drops.
Okay.
And that's the difference between the two.
What are the symptoms of pink eye?
Well, basically red or pink eye, itchiness, irritation, watery eyes. It could be pussy, thick discharge, and sometimes eye pain. What you don't want to see is difficulty seeing.
Ooh,
if you have vision problems, that's really beyond conjunctivitis, and you need to seek medical attention.
Okay, so that's really good to know that. Okay, so when we think about this, pink eye, it's just there's just something, especially when it affects young ones, little ones, and you see them with the red eyes, you feel so bad. You feel like they're suffering, that it's it's quite uncomfortable.
In most situations, you feel you got sand in your eye or a finger in your eye. That's what it feels like. So really, what we have, this is the white part of the eye, so it becomes really pink. That's why I'm going to draw it this way, and then this side as well.
There as well.
Pink like there.
Yes.
Okay. So that's really what we see. So it's the white of the eye.
Okay.
However, you can get some pus, you can get some discharge. Now, one thing that you don't want to see, in addition to visual problems, is if there's redness beyond the eye, down here. If you get spread of the redness here, this means that the skin underneath the eye is infected, and that needs medical attention. Fortunately, these are rare complications. In most situations, these things will just go away with treatment. And you can see I can sort of magic treatment, it goes away.
With treatment.
So really parents, once the child has it, if there are difficulties, if the child is young, get medical attention.
Sure.
Speak to your pharmacist. But again, this will go away. And again, at home, don't share towels and those type of things if it's infectious.
That's good to know. And like you said, if you see that redness start to seep
That's what you
below
don't
the
want.
eye, then you really do need to seek medical attention.
Yes, you do.
Redness in the eye, pink eye. Can you go to your pharmacist?
Yes, you can. The pharmacist can help you diagnose it and give you the appropriate drops.
Okay.
I can tell you, just as important as the drops is the compresses. So if it's infected, warm compresses will really soothe it and help cure it quicker.
Okay. Oh, we're so glad glad you're here. Dr. Paul talking about the symptoms and ways to prevent pink eye, the spread of pink eye.
The spread of pink
anyway.
eye, exactly.
Yes. Dr. Paul, it's always a pleasure to have you on the
My
show.
pleasure to be here.
Thank you so
Thank you.
much.